September is National Childhood Obesity Awareness Month. The month is dedicated to educating the public about the serious health condition and how to promote healthy growth in children. According to the Office of Disease Prevention and Health Promotion, 1 in 3 children in the U.S. are overweight or obese. Dr. Soren Johnson is a pediatrician with Novant Health. He says childhood obesity puts kids at risk for health problems like sleep apnea, liver problems, diabetes, and more.
Just long term, we know that the longer that you have problems with obesity, or the longer that you have diabetes, the more and more likely you are to have cardiovascular disease, so problems with the heart down the road.
Like many other conditions, COVID-19 has made childhood obesity worse. Dr. Johnson says more than a year of remote learning has given children more reason to be sedentary. He says there are several things parents can do to help keep their children active.
Number one thing is probably cutting down on screen usage, and some of the times, we say that we have to look in the mirror and be like, what example am I giving to my child? Am I staring at my phone all day? Sometimes that's the place to start. Be like, maybe I should change my habits, and that'll help my kid be more active.
In addition to promoting physical fitness like sports, jump rope, and bike riding, Dr. Johnson says families should try to eliminate sweet beverages like sodas, flavored milk, and sports energy drinks.
Basically, an extra 3,000 calories is going to equate to about a pound of fat in the body. And if you're drinking a soda a day, that's an extra 180 calories. You can do the math. Over 2 weeks, you're gaining an extra 3,000 calories. So that's 2 weeks per, a pound every 2 weeks of extra sugar your body didn't need.
For the toddlers who may not be old enough for organized sports or activities, Dr. Johnson suggests taking them to the park or just getting outside where he says they're naturally going to move. So I asked you on my Facebook page, what do you do to stay active? Jeff says, before I start the workday, I do strength training and cardio at the gym. I have more energy in the morning. Joy wrote, walk my dog. Sophia says, Zumba, walk, swim, hike, kayak. Lolita says at 75, it's turbo water aerobics. Easy on these old joints. And then Jay says, I walk 3 to 5 miles every morning.
It's impressive.
Yeah, it is.
You know what I really want, and I've always wanted these ever since Tanya got one in her office here, is a stand-up desk.
I knew you were going to say that.
I would love to get one of those, or one that has where it's on a treadmill where you're constantly walking.
Oh, that would be really
that.
neat.
Mm-hmm. Well, she also has that big blow-up kind of.
Oh yeah, with the ball that you
thing
sit on.
Because it keeps you. You have to work your core a little bit and keep your balance. When you're working, so she's doing it all. Meanwhile, I'm sitting at my desk. I do work out. It's 3 days a week in the mornings, but I have to do it early because with my schedule and then kids and all that stuff and bedtime, I would not have time if I don't do it. I hate doing it early in the morning, but it's the only time I can do it.
Now that it's gotten a lot cooler, I've been doing a lot of walking lately. Like yesterday, I walked about 3 miles. But one thing that's helped me recently, I just got this Apple Watch a couple months ago, and it tells me when I need to get up to move. Like if I've been sitting down for too long, it says get up and move for a couple of minutes. So I found that to be pretty helpful because you close your rings throughout the day. So I always plan to do that.
How funny, when you were saying that, as soon as I got my Apple Watch, I really didn't like when they did that, so I shut off that feature.
You shut it off? I actually like it. I actually get up from my seat and, kind of move around and stuff when mine goes off.
When you were reading the list of things that aren't good for you, like the sugary drinks and the energy, and I think about when I was a kid, we did all that. It was horrible, the stuff that I used to eat and drink as a kid.
And I don't drink sodas as much, but I do like juice, like orange juice and different things of that nature. So when he broke it down to, you could basically gain a pound or 2 every 2 weeks by drinking maybe, a glass of juice a day.
And some of those juices
kind of alarming.
Filled with sugar too.
And it's unfortunate that it's expensive to eat healthy.
Yes, that's true.
And especially for families, when you've got, four kids, I mean, think about how expensive that is when it's easy to just go to McDonald's and pick everything up you want for $10.
I'll show you my debit card and you can see how expensive it is. 4 kids trying that.